Bringing a new baby into the world can be stressful, and today we have a lot of tools to make it safer and more comfortable that we didn't have just 50 years ago. And in tonight's Parenting and Pregnancy, sponsored by Women's Care, KEZI 9 News anchor Renee McCullough shows us how things have changed for women in one of the most important milestones of their lives.
Things have changed a lot since Dr. Tina Schnapper started delivering babies more than 20 years ago.
We do a lot of simulations, we do a lot of collaboration.
But there's no comparison to childbirth now compared to 50 or 60 years ago.
In the 1930s, the first antibiotics were developed. The 1960s is when we first started using ultrasound for pregnant women. Then the 1970s was when epidurals first started to become commonplace.
The formal training of midwives didn't start until the 20th century, and before that, most women had their babies at home.
Before, the 18th century, having a baby was kind of woman's work, right? Men were not involved in it for the most part. But in the 18th century, what happened was men started to actually study the birth process, and they kind of started to make it a little more scientific. And these people were called, they called them male midwives. And they started to develop things like techniques for breech birth, which actually was a very dangerous thing to do back then. And then they also developed the use of forceps, which are an instrument that helps deliver the baby.
Forceps aren't used as much these days, and most deliveries are in hospitals designed to feel homier and less sterile.
All of our rooms, though, have nice big jacuzzi tubs for women to labor in if they want to, but we also do have emergency equipment. Typically in these homier rooms, we try to hide them behind cupboards and things.
Certified nurse midwife Tina Cowell says midwives are still in the picture, but they're far more educated and they can offer pain medication or an epidural if a patient prefers.
I like to tell women that we want to embrace their home birth in the hospital if that's what they choose. And there's a lot of women that really love that because we have things at the hospital that they may not have at home. We have big labor balls that they can sit on, and the beds that they actually end up delivering in change multiple positions, so it allows her to be in whatever position feels most comfortable and most natural for her.
Moving forward, Dr. Schnapper thinks we could see more changes in how we take care of women, especially after they deliver.
It's actually called the fourth part of pregnancy, basically, and there's been a push to really extend that beyond 6 weeks, which is the traditional time, to really extend it up to maybe even a year after a woman's had a baby.
She says it can be especially important because a lot of young women don't have regular doctors and they already have a relationship with their OBGYN, so it makes sense for them to help them with things like birth control, hormones, stress, and other life changes that are happening in that first year of a baby's life. In the studio, Renee McCullough, KEZI 9 News.